What started as a small shelter for Cuban refugees more than 50 years ago has grown to become Miami-Dade's leading resource for the homeless and the area's poorest residents. Camillus House and Health provides an array of services from basic necessities like showers and meals to job training and help with permanent housing. Joining me to share more about how Camillus helps the homeless and how you can help, we welcome Sam Gill, Vice President of Community Integration at Camillus House and Health. For those of us who grew up in South Florida, we certainly are familiar at least with the name Camillus, as we pretty much see it everywhere, especially on the highways. But can you talk maybe briefly about its mission and what it is you do exactly?
Well, I think fundamentally what we do, or we try to do, is to help the most vulnerable in our community. And oftentimes that equates to helping the homeless who have no one and nowhere to turn. So Camillus House really is that safety net that they turn to. So we provide, the basic services such as showers, as you mentioned earlier, shelter, but even more complicated services that involve treatment, medical care, really kind of the psychosocial kind of array of services that are available out there. Camillus House is kind of a one-stop shop, so to speak, that someone who's homeless can come in and rebuild their lives.
So you're in every way also focused on the remedying of really chronic homelessness. And before the show, we were talking about major factors that contribute to chronic homelessness, and you identified one in particular.
Yes, absolutely. Yeah, chronic homelessness is a problem not just here in Miami, but throughout the United States. And that is really kind of defined federally as someone who's been homeless for a year or longer, have had two or three significant episodes of homelessness in the last 3 years. We're dealing with individuals who primarily have a mental illness, a substance abuse problem, or a combination of these two. Of course, it could also have a disability, such as not only a physical one, but also a mental one. So it is a problem, and they're really the hardest to reach individuals in the community. But I think Camillus House in particular, that is what we have really kind of have a niche in terms of what we do.
What is the Lazarus Project? Issues Reports did a story on this a few months ago. The Lazarus Project in every way tries to address chronic homelessness with respect to mental illness and substance abuse, right?
Correct. Lazarus Project is a new initiative, fairly new for us. And the premise of that is that individuals who are mentally ill and living on the street for a prolonged period of times are resistant to coming into shelters. And the idea is that many of these individuals, if treated with the right medication, will be able to make some good decisions as to leaving the street. So we have mobile medical units that are going out to the street along with the City of Miami Outreach, engaging these individuals, building trust, and eventually also providing medications to them on a daily and weekly basis.
Excellent. I want to take a look at what we sort of highlighted back in June. Formerly homeless woman, now we'll see what she has to say about her experience with the project itself.
During the first 6 months of being homeless on the street in Miami is when I met Lazaro, and he took my name down and he told me that he was going to sign me up for a program so that I could get into permanent housing. And I was just flabbergasted. I was just so excited because I could just see it coming tomorrow. I knew I was going to be off the street tomorrow. But it didn't happen that quickly. But it was, believe me, it was well worth the wait when it finally did come. Oh, I'm doing wonderful. And little by little, things are coming together. Of course, I'm a woman and I want it now, and I want it all together right now, but it's all coming together, slowly but surely.
Amazing. We often forget about those that are marginalized and at least on the face of it have lost all hope. There was a lot of skepticism surrounding the Lazarus Project at first, but now pretty much everybody seems to be a believer. What is your reaction to the project and the people therein?
Well, I think you're absolutely right. I think that there was some skepticism, the idea that there's a lot of resources being put into place to help a relatively small number of people, but those are the biggest users of all the different services in the county, whether they be the emergency hospital, jail system, or even police. So what we're seeing is a tremendous impact. We've already been able to place over 75 individuals in permanent housing. These are individuals that have been on the street for many, many years, in some cases 15, 20 years, a drain in the system, but now, you know, they're living a dignified life. They're being cared for. In many cases, some of them are able to live somewhat independent lives. Others are probably going to end up living in situations where they're going to have some sort of support.
Right. Pivoting a bit to the city of Miami Beach that implemented a new initiative just a short while ago, the law allows a person to be held for assessment up for a few days, I think 5 days, and then committed for actual treatment up to 90 days following a court hearing. What is your analysis, or what are your thoughts about that, and how is Camillus sort of helping? Well,
we actually, it's interesting you should ask. We just met with the folks in the City of Miami Police Department recently, this week actually, and what they have seen, and this is not unique necessarily to the city of Miami, or rather the city of Miami Beach, is there are a handful, a small subset of individuals who are extremely chemically dependent to alcohol. These individuals have been out in the streets for many, many years, and their health is visibly deteriorating. And so their concern is they've arrested these individuals for minor offenses, nuanced offenses many times. They've used the Marchman Act, basically Baker Act, these individuals, place them into crisis for observation. Typically they're released within 72 hours with not much taking place other than just the person coming back on the street. So they have gone a different route, and that is to try and ex parte these individuals into an involuntary treatment program. And so we're talking about 5 individuals right now that they've been working with. They have been placed in treatment. My understanding is that there have been some success in terms of those individuals now. I guess the issue here is these individuals probably, if an intervention isn't made, they're probably going to die on the streets because that's how critical it is, and that's how far gone they are. Because ultimately, they're not going to, by their own choice, they're not going to stop drinking and leave the streets and seek the help that they need.
Right. Is Camillus House equipped to potentially deal with the influx of patients as a result of this initiative?
Well, we have limited resources like everyone else. We would love to say, yeah, we can take anybody and everybody, but the fact is that we can't. Right now, I think we have 6 beds that are available for treatment for homeless individuals, but those beds will soon, very quickly be filled. So I think that's part of the challenge that we have in terms of addressing this issue locally, not just in terms of just the number of permanent supported housing units that are available or not available, but also the treatment beds that are needed.
Okay. Sam, I really appreciate you taking the time, especially to highlight these important initiatives for, again, those of society that are forgotten and neglected. Very important. For more information on Camillus House and Health and the services they provide, visit camillus.org.